hope that you're enjoying the summit so far. Really, you've got an encyclopedic opportunity to find out about every which aspect of data and really feed into the whole discussion. Coming up soon, we will have a live panel chaired by former number 10 and Treasury Policy Advisor and Senior Fellow at the Institute for Government, Jill Rutter. And she and her guests are going to be discussing how policymakers can make data really work hard when they're designing services and planning critical infrastructures. So stay with us for that one. But first, we're going to turn our attention to a really important topic, which is data in the pandemic. Now, this panel was recorded before England went back into national lockdown, and it features Millie Zamata talking to guests about what COVID-19 is teaching us about handling and using data in a crisis. However, the panel will be joining us live immediately after the video, so do please post all of your questions really quickly while you're listening so that I can ask once again as many of them as I possibly can. Let's take a look at what they had to say.
So Reema, what has your role been around data and the COVID pandemic?
So I lead on the public engagement work at the Lovelace Institute, which is an independent research and deliberative body that looks at the impact of data and AI on people and society. And during the pandemic in the UK, we published a lot of work that looks at the impact of a digital contact tracing app. We've done a COVID-19 tracker, looking at the users of different technologies and published that openly. And we also ran an online public deliberation process that sought to engage people throughout lockdown on the uses of technology in response to the crisis.
So were you doing that work as a response to the pandemic, or is it something that was already in process when the pandemic began?
It was a response initiative in terms of the public engagement initiative and all of this other work. We've authored a report called Confidence in a Crisis, but we were really interested in how you could demonstrate that public engagement was possible at such a difficult time when everyone was in lockdown. So we used and adapted online citizen jury type models in order to explore the issue. And of course, there was a really live societal debate about the users of contact tracing, but also health data technology more broadly and data infrastructure. So I'm really keen to have this dialogue, firstly about how we actually made that happen, and secondly, what people told us about their experience as they were going through the process.
That's really brilliant, the idea that just because it's a crisis, you don't lose those deliberative activities, those democratic, frameworks. That's excellent. Pablo, what has your role been around data and the COVID pandemic?
There is a lack of open data in Mexico. So this is a problem we've been facing for years. And when the pandemic hit us, we realized that the importance of having data, open data, quality data in order to make decisions. This is something we faced for corruption, and we realized that it was going to be obviously a challenge for the pandemic, for everyone, for citizens, for public, for authorities to make better decisions. So we decided to jump in, use our knowledge on standardizing data, identifying this data, and then promoting a guide to open and standardize this kinds of data. So that's how we made this leap into the pandemic.
So you've been working quite directly with the data itself and data across different sort of sectors and categories. So what have you seen as the biggest challenge for that data to be useful, at least in the early stages of the pandemic?
There are plenty of challenges in Mexico. As we're a federal state, which means we're composed by different states that have their own governors and their own autonomy. So this means we're a kind of a puzzle where the data is published in different data silos and in different formats and in different. So one of the biggest challenges is that heterogeneity that we have in Mexico, where someone publishes data in one format and in one way, and someone from another state publishes data in another way. So this is one of the biggest challenges, to standardize data for the whole country. This is very challenging because a decision that's made at the federal level impacts the whole country. But how you make the decision, which data you use to make the decision, also impacts the whole country. So if you don't have the whole picture and the data from the whole country, you cannot make a good decision.
So I really want to follow up on that, but maybe we'll come to that later, because I'm interested as to why there are the differences, and some of it might be capability, as you say, but there might be other reasons for those differences. But Reema, have you seen any challenges for data to be as useful as it could be in the early stage of the pandemic?
Yes, I mean, certainly. I think there's several aspects of it, but one of the really interesting aspects is that there have been data and data sets that have been stored or been retained in silos, as Pablo says. I think that's an experience that we have very much in the UK. When we think about, for instance, the 100,000 Genome Project, or genomic data that we've had, or data across the NHS, often that data has been fragmented. And one of the big challenges that government and NHS organisations have had to respond to very quickly is how to get the relevant information in an accessible format as is possible to the right decision makers to respond in a timely fashion. And yes, that has been a really striking challenge. But there have been other challenges, and some of them are quite societal. So, for instance, the systematic underrepresentation of particular groups on data set has been a really striking challenge in the context of a crisis that we know has disproportionately impacted on different groups and different people in society. And so there's this kind of question of, for a long time, people have been talking about the missing data in the data set. And so it isn't just about the joining up of government and existing data that's already existing and getting that in the right places and governing that ethically. It's also about who is represented in the data and who's being reflected in the data, and whether we've actually got the right data in some instances, or in the right data in the right way. And a lot of this actually came up in our public deliberation work. So a lot of people were really wanted to see consideration of impact upon different groups, and this became more and more prominent as during that process the Black Lives Matter movement really took off. So that was quite an interesting thing. We were running a deliberative process in the middle of lockdown as the Black Lives Matter movement took off, and that really informed and influenced and shaped people's considerations of these issues.
And I think that point about the societal considerations, or the kind of societal gaps in data, is really important, because data infrastructure is not just technology, it's also people, it's also the institutions around the data, the governance or the collection of that data, and so on. So I wonder, so taking that quite broad definition of infrastructure or data infrastructure, was our data infrastructure ready for a crisis like this? Was there anything that was kind of ready to be built upon? And were there any gaps? It could be data gaps, as you mentioned, or it could just be, gaps in how we go about thinking about data. So Reema, I'll start with you.
Yeah, I mean, it's a really interesting question, because, firstly, how do we define data infrastructure? And so I'm not going to try to attempt to answer that question at this moment in time, but the way I'm interpreting this question is the way that we manage, use, steward data, was that set up in the right way, and what were the challenges around that. And I guess the important thing for us to remember is that this is a public health crisis. So actually what we're talking about is the data infrastructure that's operating in a really complex system, which is our health system, and our ability to respond to something that's incredibly complex. And so my answer to your question is no, because I think that there's something about the complexity of the system that it's fair to say that I think any country in the world would not say that they have been wholly adequately prepared for something of this scale. And so that really presents us with a challenge, which is how do we make sure that in future years to come we do have a wider public health infrastructure that's set up to respond, but within that also the data infrastructure. The data infrastructure is supporting a wider public health infrastructure. And it's really important we don't lose sight of that it's kind of somehow abstract or this thing that is disconnected from the societal outcomes and the ability to respond that we're trying to realise.
Yeah, it's kind of all the back office stuff, you know, which, you know,
Absolutely.
or looking beneath the hood of the car. I mean, Pablo, can I bring you in on this? So what barriers have you seen to working with data effectively during the pandemic, apart from the standardization and the silos? Have there been other barriers?
Yeah, I think we've seen lots of barriers. One of the things we realized is that in order for data to be useful, it needs complementary data. So this is what we realized. Each data set that is published is very useful by itself, but if you combine it with another data set, you can use this information to make better decisions.
I think that's a really important point. So, you know, it's not just a health crisis, it's also, as you say, an economic and social crisis. So you need lots of different kinds of data, maybe not just government data, but commercial data and so on. But even if it was just a health crisis, maybe you'd need different kind of data sets to address that. So it's back to that holistic strategic vision and understanding of, you know, there needs to be kind of that interoperability across data sets. So just in the last few minutes we have left, I wondered, do you think anything has shifted in the perception of data as a result of this? I'll start with you, Reema. So has anything shifted in how data is perceived?
So what was fascinating about the Public Deliberation Initiative was because it was 3 weeks immediately after lockdown, it covered a range of events, major public events that happened in the UK. You know, the introduction of the Isle of Wight pilot. So we were talking about that in the first week. Then we had the entire Dominic Cummings saga, and then we had the Black Lives Matter movement, and all of that happened in that time frame. And what was really striking was the extent to which there was a real fluctuation across the period in terms of the nature of how people felt. And so my answer to that is absolutely yes. And I don't just mean pre-pandemic and while we're in the pandemic, I actually mean throughout as these conversations have evolved. I think there's been a real fluctuation in terms of levels of public trust and confidence and the use of data and different types of technologies to respond to the crisis. I think we need to better understand what that looks like, and also better understand that in terms of differential impacts. So how did different groups feel as a whole? That's a piece of work that we're about to begin undertaking, is just to research that more deeply. But it's clear from the work that we've done so far that absolutely, yes, there has been a shift. What was quite interesting in that work was the recognition, growing recognition, despite everything that had happened, that it was really important that people felt that they were contributing to a societal response. And over time, I think that there was just a general trend of feeling more open to the idea that people would share their data or donate their data, as it were, for public benefit purposes. And that was something that came out really strongly in the work. And, you know, a lot of people use terms such as, you know, we're all in this together, and the sort of sense of how data sharing could be a really crucial part of contributing in a meaningful way to helping, you know, one's communities and one's neighbours. But of course, that was balanced with concerns people had about differential impact, and also on their own, you know, on managing for any risk of harm that might arise. So people also wanted to see assurances that their data would be protected or only used for purposes that they legitimately expected it would or could be used for.
I think that's so interesting. And there's so much more I'd like to ask you about, but we've only got a minute left, so I hope we can pick up in the Q&A. But I want to give Pablo the last word. So in the final minute that we have you seen anything shift in the perception of data as a result of all of this?
Definitely, yes. I do agree that this crisis pushed us to have a different understanding about data and the importance of data. In Mexico, we've been stuck for years with transparency as a way to open things, but transparency without reason and without purpose, which means transparency as publishing everything on PDFs about public contracts and things like that, but not open and standardized data. So I think this crisis and that's also one of the hopes I have of the outcomes of this crisis, is that we understand the importance of open and standardized data in order to process these huge amounts of data, which we've been discussing right now. So I do think there's been a shift within the government itself of understanding the importance of publishing open and standardized data, from not only from as I've been saying, not only from the health sector, but from other different sectors, in order to make better and more informed decision making. So I do think definitely we've seen change within society. I think everyone's understanding the importance of data. I mean, the importance of putting attention into what data and to what numbers say regarding trends, regarding things. The emergency pushed us to look at health data right now, and people are more attentive on looking at data and seeing how the pandemic shifts and how things change. So I think this trend should also become a more permanent thing for people and for society to understand and see actually how things move within the country, how indicators move, and how this impacts their daily life. So yeah.
I mean, that's absolutely brilliant, and I'm really looking forward to seeing what emerges in the Q&A.
Right, so we've got lots of questions coming in here. Let's kick off with one from Paul Connell. On a score from 1 to 10, how well has England and the UK done with data in the pandemic?
I think it's a really interesting question. We don't know the answer yet, and that's a really striking point. Actually, a question that I posed to John looking out. So one of the challenges there is, give me a moment because I've got to go back for my own conversation. Okay, so what is, I could to myself, that was not very helpful, myself speaking back to myself. So I think one of the big challenges is I couldn't give you a number, and one of the reasons I couldn't give you a number is we don't actually know the evidence, or we don't really know how data is being used, and it would be really interesting whether the government might consider an independent review of the impact of data initiatives, the range of them, what they are, and how well they work. That's something I think for us to reflect on. And off the back of that, one of the things I have done is look at literature on past pandemics. One of the things that's quite striking there is how little there is of intervention. So it is a gap, it's an ongoing gap. It seems that actually we don't quite learn from past experience. So setting up mechanisms would be really helpful and interesting.
Excellent. So we've got another question here, an interesting one. Can there be a mandate for sex segregated data? And if so, how do you take account for old data that isn't? Interesting question. Who wants to pick up on that one? Okay, I'm just going to repeat that question in case you didn't hear it, which is, can there be a mandate for sex segregated data? And how do you take account for old data that hasn't been?
So
thanks, Maggie.
So Pablo,
go ahead, Reema, please. No, please.
So can there be a mandate for segregated? So it's a challenging question. So there's one question, which is, what is the data and what it relates to? Is it segregated or not? And what is the segregation of that data? I think it's hard to say just because data is segregated, there can be a mandate for it. We need to think about its use, its application, what it is, how it relates, the justification for it. So those are all things to think about. And just to say myself, speaking back to myself, that that's one of the big challenges. I'm going to take my set off.
Yeah, Pablo, did you
I
want
will
to add
jump
something
in.
to that?
Yes, thanks. I will jump into the last bit of that question regarding the old data, which I think is very important, because what we faced during the pandemic is the lack of information and the lack of data to make better decisions. And we're not talking about only the data that is generated. Sorry, I'm also listening to myself. So we're not talking about only the data that is being generated as time goes by, but also the data that was generated in the past is very important for decision making. And I will give you one example, which is in Mexico, for example, we have a very big crisis on obesity and diabetes. And this mixed with COVID has become a very big health emergency, and the cases of COVID that mix with either diabetes or obesity are more severe. So if we had enough data regarding these pre-existing conditions about people, the decisions making process on how to tackle the pandemic on a health approach would be a lot better if we consider all these different variables. So this is just one example of the importance of old data and the importance of having the old data standardized, open, and able for use in the decision-making process right now.
Yeah, it's interesting, isn't it, Pablo? Because there are two things with this, is that if you are using data which is out of date, then that can cause the wrong conclusions to be drawn. Bob Bailey raises an interesting question here by saying, does data, which might be donated for helping in the immediate crisis, have a use-by date to avoid it being reused years later for other purposes that the donor may not have agreed to? I think that's an interesting question.
And it's certainly an interesting question because looking at this from the public engagement perspective, it is clear that members of the public might well expect or anticipate data could be used for a particular purpose to respond to a pandemic, but they may have different expectations around the use of that data outside of a pandemic. So there is a lack of clarity often around the use and the governance of data and what public confidence and trust might look like. Both in terms of how it's being used at this moment in time, and also how that compares or contrasts with expectations around its use and its governance and structure later on. So yeah, it's a really crucial question, and it's one of the questions that a lot of public deliberation initiatives emerging are looking at examining. So to what extent do people expect their data to be temporarily, or their data to be used in a temporary context, and what are their expectations emerging out of a pandemic for longer term use and for wider societal benefit after the pandemic has been dealt with?
Yeah, it's a really interesting issue, isn't it, really? Because sometimes what I've been quite fascinated to see is how people who I know are quite comfortable with handing their data over to shopping sites are going, oh, I'm not sure about releasing my health data. And it's very interesting. Sort of on this subject, a great question from Lucas Gross here, which is, what kind of data adds a lot of value when it's brought in?
Well,
Who'd like to take that?
I think this health emergency brought to light the importance of and the importance and the links between data sets on different aspects of our daily lives, and what impact they have on the way on the government and decision makings are taken. So this is a health emergency, and health data and things around COVID are very important. But as I've been mentioning during the past few minutes during my remarks, I did find the importance of having other data regarding social, economic, and political aspects that impacts daily people's lives in order to make better decisions. And having this data open and available to the public helps everyone live their daily lives today in such an important moment and a challenging moment as the pandemic, to make better decisions. And I'm talking about, if you know which shops around your block are open, or which coffee shops or restaurants are open, and you go and help and support and buy from them, that basic things such as that one of where to go and buy locally to support your community are very important. And these kinds of data are not being collected in all its sense and the way they should be, and this data has not been standardized. So I think the big effort and the big lesson from all of this is the importance of data that didn't seem as valuable during this pandemic for daily decision making.
Yeah, I think you've kind of answered Louis Fernandez's question, which is, he was very curious to know whether there were interesting discoveries made when you combined the health data sets with other data sets, such as the social ones. And I guess that's what you're saying there, really, isn't it? Is sometimes you don't know what you don't know. And that's where the pandemic has been incredibly helpful, really, hasn't it, in highlighting areas that we, in the future, we may be able to bring to bear and make better decisions when we're faced with another crisis.
Exactly.
Right. Okay. Time, I think, for one more question. This one from Paul Colville-Nash. Do we put enough effort between central actors, such as government policymakers and the public, to better explain the risks of data sharing alongside the positives as a mean of engendering trust, rather than focusing on the benefits and trust us? Has the media played an appropriate or responsible role in delivering this debate to society more broadly?
It's really important that we do have a balanced analysis of the benefits and the risks that come from data sharing. And I think the media has a really central role to play in terms of articulating both and being able to be clear about that, but also the government and the NHS has a central role to play in doing that. I think that's really, really key. Being able to articulate the impact of data sharing is central to building public confidence and public trust in data sharing. And so there's that aspect that we need to better understand.
Brilliant. Well, we had lots of questions there. Oh, right, go on, Pablo.
Just to add on what Reema just said, I do think there is a very thin line between the data we share and the ethics between the data sharing and the data use for the government, especially the data that is derived from the pandemic. So I do think we need to have a further discussion and to analyze the pros and the cons of using this data in the future, as it has been mentioned, and the ethics behind it for a better decision-making process, and to what extent are we going to be able to use this data in the future.
Yeah, absolutely key. Well, Pablo and Reema, that's all we have time for the moment. Thank you so much to everyone who's been posting those questions. And also, I noticed that there are some links being put up too. So do have a look down the chat function and you'll be able to follow more of the discussion there. So for the moment, thank you both very much indeed. Don't forget that coming up later in the programme on stage 2, we will be hearing more on this subject from some of the leading lights in health data and health data research, including the Wellcome Trust and NHSX. And if you are particularly interested in COVID-19 data, there's also a roundtable about data discovery through the pandemic, and that's being hosted by ODI's Head of Research and Development, Olivia Theroux. You can find out more about all of these sessions in the programme, and if you click on the reception button on the menu bar to the left-hand side, you'll be able to find out all the details that you need. there's lots more to come here on stage one. After the first coffee break, which will be in about 45 minutes time, we'll be hearing from the ODI's president, Sir Tim Berners-Lee, Sir Nigel Shadbolt, and the vice president, Dr. Jenny Tennyson. And I'm going to be asking for their thoughts on the state of the data nation. But now we turn our attention to policy making, because the significance of data's role in policy has never been so publicly obvious as during the COVID-19 pandemic. I'd like to introduce the Institute for Government Senior Fellow and former Senior Civil Service Advisor to Number 10 and the Treasury, Jill Rutter.
I'm a former policymaker
Excellent.
in the UK civil service and now a senior fellow at the UK's Institute for Government, a non-partisan charity. In the next 45 minutes, we're going to look at how governments use data to make policy and how they should use data to make policy. Those may not be quite the same thing, so we're looking to close that gap. I've got a fantastic panel. Please post your questions to them as soon as you like, and we'll allow loads of time to get through them. So joining me are Laura Gilbert, Director of Data Science at 10 Downing Street. I think it's fair to say Laura is the first ever Director of Data Science in 10 Downing Street. That's the Prime Minister's office, for those of you who don't know, behind that black front door. So she's going to join us. She's quite a recent recruit. Then we've got Aidan Ayakuzi, Executive Director of Twaweza in East Africa. Apologies to everybody there for my pronunciation. But Aidan's going to bring in a civil society perspective. And then to keep us honest, we have Mevan Babaka. Mevan's Chief Operating Officer and Deputy Chief Executive Officer of Full Fact, the UK's leading independent fact-checking charity, but also part of a big worldwide network of fact checkers. And Mevan's been particularly instrumental in developing capacity for automated fact checking. So we're going to start off with a couple of questions from me. We'll have very snappy answers because we've only got 45 minutes. So we want to make this pacey and fun and informative. So Laura, as I said, you've just been recently recruited into the Prime Minister's office to help government up its data game. So what are your first impressions of how government uses data, and what are you focusing on as room for improvement?
It's obviously a very exciting time to be in government and working with data in general. And it's a very good place to be a data scientist because there's a very great deal of different types of data coming through, from sort of very well measured numeric to quite social sort of levels that we can look at. So there's a lot of work that we can do. There's a huge drive at the moment to improve the use of evidence and the transparency of evidence and the quality of data in government decision making, which is why this role and the team has been set up to really push this sort of process forward at the moment. So it's very exciting for us. There's a lot of work to be done. This is a very old system with a lot of processes in place, obviously, and it's always difficult to really change a huge system. It tends to run behind the times. It's built on quite an old technology stack. There's a very massive government-wide drive to reduce reliance on legacy technology, to increase the data flow between departments. But there's still a lot of work to do on that. There are always questions around data ownership, privacy, what data can legally or ethically be shared and what can't. There are some questions which are more difficult than you'd think, whereby you can even take depersonalized data from one department, and if you release that data set with depersonalized data from another department, even though separately they're harmless, it's possible to identify individuals if you then plug those together. So there's a lot around being very careful not to put people at risk. But at the same time, moving forward, we're very, very keen to have a lot more evidence base in everything we do, including the idea of sort of making sure that metrics are included in policy decisions going forward, so you have a better idea of how well your policies are doing. There's more experimentation going in. We have a good way to measure how well things are running as they go along. We're really trying to push the idea of more data transparency and more evidence transparency from the centre. So we're also hiring, if anyone's interested, so get in touch.
Okay, so there's a very useful job ad there from Laura. So that's the sort of perspective from the inside. I'm going to go to Aidan now. Aidan, what does it look like when you're trying to influence government using data, but coming at it from the outside? Aidan.
It can look incredibly daunting, Jill. But what we try to do is to tell stories, really use data to persuade government officials, policymakers, mid-level technocrats to take decisions, move resources around in a way that hopefully will achieve the aims of both the civil society and the government in a particular direction. So maybe I should try and be more concrete with a couple of examples. A few years ago, about 8 or about 10 years ago, we embarked on a huge data collection exercise in East Africa. And we wanted to really ask the question, and this was the narrative we wanted to engage with, are our children learning? There's a huge amount of investment that society, both government, parents, and others, place in educating children, especially primary education. But we weren't sure that the children were learning. And remember, if you go back to the Millennium Goals, the key metric was everybody should have access to education. And in Tanzania, we achieved it. Boys and girls were enrolled in primary education, but were they learning? So we collected a lot of data to try and answer that question. And quite often the answer was not necessarily what the government wanted to hear. And so they questioned it and queried it a lot. How can you collect this data? We used volunteers to collect the data. They said, how can volunteers assess children? But we had a very robust mechanism for doing that. And we showed that between 1 in 3 and 1 in 4 kids would go through the entire 7 years of primary education and come out at the other end, for all intents and purposes, illiterate and innumerate. This was not liked very much. But come 2012, 2013, and our 4th form exams were the worst in Tanzania for a very, very long time. And I think suddenly there things clicked, and the government said, "Oh, maybe you were onto something with your early grade assessment on whether our children were learning or not." And so that issue, that question of focusing on learning outcomes based on the data that we had collected, became important. And a lot of Tanzania's development partners and donors are now focusing on improving learning outcomes, not necessarily putting aside the issue of access to education, but learning outcomes has become really much more important. So, we try to engage with the narrative. We asked a particularly easy question, but hard to answer, and made sure that we had the evidence and the data that was really quite deep and very broad-based to answer that question. So that's what I'm calling a blunt approach to getting government and policymakers to listen to the data. Maybe next time I can tell you about a much sharper approach. We're actually using experimental data and a randomized controlled trial, again, to help government pay the teachers actually better so that they actually deliver learning outcomes in Tanzania.
I just want to actually throw that point from Aidan back to Laura. Laura, how much use you use of data that's coming at you from outside government as opposed to data that's collected by government? Or is there just so much data within government that that actually don't have that much use for data being fed at you from the outside?
We definitely have a lot of use for data from the outside, particularly from academic institutions. That we use a great deal of research, models, and data gathering from universities, hospitals, really anyone we can get hold of. I think the blocker tends to come in that, funnily enough, there aren't that many people in any one group working on things. So actually getting a good idea of the visibility of all the data that's available and prioritizing which bits to look at. It's still a system that it's relatively difficult to keep track of everything and make sure you're really prioritizing the right data sets. it's something we work very hard on, but it's not perfect as yet.
Okay, interesting. I'm going to go to Mevan now. Mevan, you've been watching governments using facts and data and calling them out perhaps where they haven't used it as straightforwardly as they might over a long time. So what's your impression? We've heard quite a lot from Laura about aspirations for transparency and communication and making sure stuff's backed up. So how do you think governments handle data and communicate it to the public?
I think that ambition is a great one. I think going more in the direction of transparency is great, but we are a very long way away from that yet. I think that too often politicians come out and use a claim or a number in public life, and that number isn't backed up with numbers in public life. It's always private data sets. I think if I could change one thing in how the government communicates, it's making sure that every single time a claim is made public, the data to back it up is also public. The Office of Statistics Regulation described it as equality of access. And actually, I think it's a really important thing for trust in the modern day. It's not enough to just tell people a number anymore. You have to also explain where that number has come from. And that's how you build trust with an electorate and with the public. So I think that's really important, making sure there's no unpublished data in public life. We've seen too many instances maybe of things being wrong and the record not being corrected. And I think in a functioning democracy, that really has to end. If you get something wrong, there should be mechanisms to correct the record, and that should be made public. And actually, there's good data to suggest that when you correct yourself, that also improves trust. So it's not all downhill when something goes wrong. It's also an opportunity to rebuild. I think that a lot of those are about communicating data, and I think take the pandemic, for example, there's been like a lot of uncertainty in the pandemic, and too often we've been given numbers with great certainty. And I think that was a misstep. I think that we could have done better to say that actually here are the bounds of this number. Take the R number, for example. It was often given as a definitive number and then changed to a range. And I think those kinds of changes, although it might seem small, actually communicate something far more complex. And that's really important for people's understanding of really difficult issues.
So Mevan, Mevan, I'm going to come in here because I've got a question from Paul Colville-Nash. Thanks very much, Paul. First question out of the blocks, which goes directly to that. And I just wondered if you and the other panelists might like to comment on it. Paul says, in the drive for data transparency and evidence-based decision-making, hat tip Laura, what have we learnt when the public can't join the dots between complex, even uncertain data presentations and policy development and implementation? I'm going to widen that beyond the public to include parliamentarians, arguably, perhaps even some civil servants and ministers. Mevan, let's go to you first. Do you think that is transparency enough, or how do we help people interpret that data when they all haven't got advanced degrees in statistics and probability or what else you might need? Mevan first, and then I'm going to come to our other two panelists.
It starts with having the right measures in the first place. And I think that, sorry, let me start again just because I could hear myself and it was very off-putting. So it starts with having the right measures in the first place. Take, for example, Boris Johnson and Keir Starmer got up in PMQs, and one of them said COVID deaths were going up, one of them said COVID deaths were going down, as is specific to care homes. And they were both right. And they were both right because they were using two different measures. And if you looked at it day to day, one was going up, and if you looked at it week to week, one was going down. So that's not necessarily because somebody has misunderstood that data. It's because there are two different sets of data, technically measuring the same thing, but in different ways. And as a member of the public, you'd be looking at that, at Prime Minister's questions, and thinking, what on earth is going on here? How could deaths be going up and down at the same time? And I think that the formats that we have do not allow for complexity and nuance a lot of the time. Neither Boris Johnson nor Keir Starmer is going to stop in a moment and say, well, actually, it seems like we have two different measures here and we're both technically right, and let's explain this to the public. What actually happens is that a lot of people leave that feeling very disengaged and being more distrustful of politicians overall. and then some political points are scored between A and B. And I think that we can make much better use of the data that we have already and communicate it more clearly and make room for the complexity and the nuance. We're very good at communicating complex things. I think as a species, we're storytellers. We can tell complex stories. It's just that we haven't actually made that effort when it comes to statistics and data.
Difficult to get people to understand, the people you're advising to both understand and be able to communicate some of these quite complex data things. Have been for our visitors overseas who aren't in the UK. There's been quite a kerfuffle in the UK recently about some of the ways in which data has been presented at some of our prime ministerial press conferences, with people saying it's quite difficult to read, quite difficult to understand quite what the point is. What are the, do we have the skills, capabilities, and indeed the quality of political debate, picking up a point from Paul Wood here, quality of political debate to enable us to have quite a sophisticated conversation about data internally and externally?
Can I just check that came to me because the sound cut out at the beginning?
Yeah, now it's coming to you first of all.
Sounded like it would do. There's
Sorry, Laura.
No worries. There's nothing that Meavan said I disagreed with. I think she was pretty much bang on about everything there. We do need to do a much better job of communicating numbers. There is often a lot more work that can be done around error bounds and degrees of uncertainty. And I think that the way those sorts of things are communicated is something that we really need to look to improve. I'm obviously new in this environment, and I come from a background that's quite strongly around public communication of science, and it's something I feel very strongly about. So it is a process that I'm certainly very keen to get sort of more involved with. I think that a pandemic situation does make it very difficult because very often decisions have to be made very quickly. We're looking at systems that are built on models, and the models are inherently uncertain, not just because that's the way that models work, but also because the target moves very quickly in this sort of circumstance. The data is difficult to measure. It's difficult to make sure we're measuring the right thing. And when people are essentially in a rush, I think the finer points of communication can be lost more than they would normally be. But yes, I think that there is a much better way to communicate a lot of this data, and I think that's something we do need to be focusing on at the moment.
So, Aidan, we've been focusing
Jill.
a bit too much about the UK. What's the position like in Tanzania? How would you describe the experience of your government senior officials about communicating with data during the pandemic?
Yeah, well, it is a tough one. Look, in Tanzania, we decided we're not going to communicate any data whatsoever at all about the pandemic, which for me is a shame. It's a mistake. But there we are. We are now having to live with COVID-19 purely from an anecdotal position, But luckily, I think, again, anecdote is showing that our case fatality rate, even our cases, may not be at all at the kind of exponential levels that other parts of the world are experiencing. So I think we've been very lucky. But I think to the point of communicating data that you asked, I just wonder, maybe ask my panelists, should it be the monopoly of political leaders to communicate complex data? I follow and I listen and I watch really great communicators of data and statistics in the UK. Tim Harford is one. Jim Al-Khalili, the physicist, is another one. Marcus de Soto, a mathematician, is another. Why can't we get these three in a room to advise Laura and the government on how to tell great and truthful stories with all the nuance that you require for people to be able to understand and therefore take responsibility for acting on correct data? I honestly think it should not be the monopoly or the purview purely of political leaders to communicate complex data. The temptation to take an objective truth and turn it into a political truth is just sometimes way beyond some of our politicians.
Well, we've got loads of questions coming in now, but I just wanted to ask Laura just very quickly on that. Do you think that the government, government should find different ways of communicating? We've seen a bit of a development with some of the sort of press conference use of slides. Someone suggested that we should use slides in Parliament. Probably a bit too radical. But do you see ideas there about how actually we can better convey information to the public, and in particular uncertainty?
I mean, definitely, yes. I think that's something that we're working very hard on at the moment. There is a slightly separate question of how do you communicate the data to decision makers. We are working towards a switch to more visual engagement at the moment. So we are starting to work on modeling dashboards, things where you can tweak the input and see how it affects the output. And that turns out to be, I think, a much more effective way of communicating with decision makers who aren't necessarily numerical by training, the effects of decisions that they make. And that's a huge ongoing movement at the moment. It's obviously very recent, we're a new team, but that's something that we're spearheading quite heavily. When it comes to communicating to the public, there are very clear ways in which things could be improved. Some of them are technological. It's easier to communicate the meaning behind a slide if you can stand next to it and point to the bits you're talking about even. So I think there's some room for a technological improvement in the way things are presented. A bit less next slide, please, which tends to go down quite poorly. And there's also, this idea of storytelling. And I think that the way that it would be nice if we moved the situation is to figure out what is the thing we're trying to communicate and then build the slides around that, rather than show the slides that perhaps the scientists use to make their determinations. It's something that we do feel pretty strongly about, and we are going to be working hard on.
Okay, let's move on. We've got quite a lot of questions coming in now about privacy and how government tells the public how it's using their data. So a couple here, one from Armel Skatulski, that's right, Armel, about, how does the government see their responsibility in better informing UK citizens, but let's globalize that to citizens and residents, about how government's using their data. A particular example they pull out is algorithm-led governance. Algorithms are indeed a bit of a buzzword around here that people are a bit concerned about. And another concern, again, from Armel, about the protection of records that are being used. I think, Laura, you were mentioning where two seemingly anonymized, harmless data sets could actually expose people when mashed together. And one from Peter de Jager about, actually, is there a technology to track what is being done with your data if it's shared? Mevan, do you have any views on any of this? Is the government good enough at communicating what it's doing with your data and how it's using it?
I think it might be a question best for Laura, to be honest.
Okay. Laura, do you want to go first?
Sure. So there are a lot of laws in place around data privacy and what is acceptable to do with data. My background is largely in medical data, which is obviously very strongly protected. I do have a very strong belief in protecting people's privacy around data. I also have a very strong belief that it's very difficult to make progress if you can't get your hands on decent data sets. So I think that people try very hard to follow the rules. Sometimes that sort of inherently causes a problem in that it makes data less accessible. And the way that we're intending to sort of improve the situation there is to make sure that we collect a lot more anonymous data sets with people fully informed, up front, that they've fully consented to, and that those data sets are essentially anonymous from the source. That's very useful for anything where you need to do scientific discovery. And we're certainly looking towards a future where those data sets are public, shared, can be used for other people to, design their own algorithms and double check models that perhaps we might be relying on. Models from more sources are better than fewer. And you will see with COVID that we're using quite a few models from different sources, different universities particularly, and they will have access to the same data and yet come out with different answers. So it's always a little bit harder than it looks, but it's a crucial area to both keep people safe. But without data sharing, we're not going to progress. So it certainly helps us if people have a more open view to sharing their data in a safe way, and we need to make sure that they feel protected doing that, I think. Which
So,
more
Aidan,
transparent.
Is this a debate that, yeah. Aidan, is this a debate that resonates at all in Tanzania? The debate about privacy and what does government do with my data?
Yes, it is. We don't have any data privacy laws in Tanzania. The government has free reign on what it can access in terms of, for example, our mobile phone networks. I think they all are under, whether it's public or not, instruction to provide what it is that government needs and wants in terms of data and what is being communicated. So people are very much using VPN to access the internet in a safe sort of way. In Kenya, they do have a Data Privacy Act. I think it's fairly recent, maybe a year or less to go with it. But also because I think the general population probably, I don't know whether it's different in the UK, is not hugely exercised by the privacy of their data. And so there isn't a really huge push from the population to get data protection. I think this is something probably that is the purview of people in the techie or in the human rights or governance fields who want to circumscribe the ability of government to use private data in dangerous ways for particular individuals or communities or organizations. But otherwise, it is not. It resonates, yes, but maybe amongst a very thin group of people, not so much a popular discussion yet.
That's very interesting. Laura, do you think that's true in the UK too, that actually the population's much less fussed about data privacy than quite a lot of campaigners, and actually if they thought it was for the public good, they'd be quite relaxed about it?
I'm not certain I'm qualified to answer that. My sense is that people are quite worried about data privacy. I think because the number of data breaches from companies has sort of gone up. You know, we saw data breaches around Zoom, Adobe. You know, I've had my Amazon account hacked because I didn't change my password after a data breach. And the more of those sorts of things that occur, I think the more people start to worry about it. There's also a sense, I think you have to trust that the government's attempting to use your data for good. And if a tabloid published something suggesting that the government was using your data to, you know, disadvantage you, that would, I think, severely impact our ability to get hold of any useful data at all. So we do have to be more careful rather than less, even if we think that people might be quite tolerant, is my sense, but I'm really not the expert there.
And just final question to you on this. I'm going to come to one with Mevan, a different question, Mevan. But Laura, do you think we've had a lot of concerns in the UK about things being done by algorithm? We had this for people not in the UK. There was a sense in the summer that awarding exam grades by algorithm led to quite a lot of problems. And the Prime Minister talked about a mutant algorithm. Do you think that algorithms are a bit of a lost cause, or what can you do to rehabilitate the reputation of algorithms?
No, I do not think algorithms are a lost cause. I think that algorithms are very much the future. Unfortunately, I'm not sure how helpful things like mutant algorithm is as a phrase. It's an algorithm that, not to pick that particular example, but a poorly designed algorithm can be incredibly damaging. The responsibility is on the researcher and the people using those algorithms to interpret whether or not they are being made correctly and used correctly. You can always have a situation, I mean, you saw in the States a number of algorithms that, for example, were AI algorithms that were tuned on recidivism data and decided from the data that they were fed in that Black people should never be let out of prison or something to that extent. They can be horribly badly designed. If they're built wrongly, if they're tuned wrongly, if the people building them don't understand what they're doing, you can have an algorithm that does a great deal of harm. But it's not in itself, they're morally neutral. It's a tool, a bit like if you build a house and you do a terrible job and it falls over and kills people, that is the fault of the person who designed and built that house. So there is not an inherent problem with algorithms. There is a hugely powerful branch of mathematics. It enables us to treat diseases, to prevent people falling, to teach people to recover from strokes, to do space exploration, to scan the side of buildings to find out whether or not they're in any structural risk. They're positive and powerful if you do it right. and they can be very damaging if done wrong. But I morally neutral and an absolutely invaluable tool from where I'm sitting.
I think the Prime Minister probably used his mutant algorithm phrase before you were in number 10, Laura. So we'll look to a change of
No, it wasn't.
language there.
No, I
Meavan.
think it's sort of very evocative. It just you don't blame the algorithm, blame the people that designed it. I suppose.
Blame the author of the algorithm. Okay.
Yeah.
Meavan, I want to ask a slightly different question. We've had from Dave Thomas. Dave has pointed to the academic world has had to manage authenticity and trust for several centuries, done it through peer review and citations, key controls. Do those have a role to play in the digital information world in general? And is there a role for citizens in keeping governments, if you like, honest about data? And I think, I'll come and bring Aidan in as well about civil society organisations as well. What do you think? Can we have citizen data watch to make sure that we can have faith in data? Even.
So on academics and scientific literature, I think we have to acknowledge that still lots of it is locked away in privately owned companies. So that makes it obviously harder to access scientific research. But there are also a lot of papers that get retracted every year. So if you want a system that actually works really fast in terms of authentication and trust, although the scientific system is great, it's not one that works really fast. And in a situation like this, where we actually need to react really fast to new stimuli, pandemic is happening, we need more data, we need to react, then I'm not sure it's exactly the right thing. I would say on the privacy conversation, that's one of my general concerns, is the fact that we have to act very fast means that maybe we don't think about privacy as much at the end of the day. And the same about transparency, actually, they get lumped into this bucket of like, oh, they're just hard, we won't think about those. And I really think they should be front and center of all decisions that get made. On citizen science or like citizen jury watches and stuff like that, we see more and more people helping us with our fact checking. So people are sending us tips of things that they're seeing on WhatsApp or family WhatsApp chats which they get frustrated at, and then they send us, or they're seeing in like closed conversations online. And that actually informs our fact checking, because not all conversations right now are in the public domain. More and more of them are going to peer-to-peer conversations. So it's actually helping us target our fact checking so that we can take the most harmful pieces of information off the internet, or to make sure we have fact checks on them. So if people look for good information, then it's there and it's available to them. I think generally it's really hard to get people to volunteer though, because there's a lot that takes precedent over that. And during a pandemic, it's especially hard to get people to volunteer, although we have seen millions of people do it.
Aidan, is there a role for civil society in keeping governments honest about data?
Oh, absolutely. I mean, one area is, for example, budget and expenditure and tax collection and this kind of thing. But it requires that the government actually publish data that is good quality, believable, so that citizens can analyze, scrutinize, and comment on how government is performing. And the other piece, of course, is that citizens also generate data, sometimes passively, sometimes quite actively. And I think that citizen-generated data also ought to be in the equation when governments are considering policy, where they're evaluating success. And some of the work that Twaweza has been doing is to try and put that citizen-generated data, our surveys, our experiments, into the public domain to help decisions that the government is making around public service delivery.
Right, I'm going to come. I've got quite a lot of questions about data in policy making. I want to come to all of things about, Anna Powell-Smith's asking, do we need systemic policy making reforms to help use data more, changes to official policy making guidance to include formal requirements to capture metrics or legislative reforms? But also a question from Carmen Ing about whether over-reliance on data might lead us astray in shaping public services, because basically we're driven by what the data tells us and miss out things. And somebody else was saying, what about the other bits, the qualitative stuff as well as the quantitative points of view? Laura, do you have a vision for what good data use in policy making looks like and what to be worried about?
Well, I'm very biased because I love a bit of data. We are driving, to Anna's point, driving quite a lot of system reform at the moment, really across government. It's something that's a great area of interest everywhere. The entire purpose for setting up the team that I'm heading up at the moment is to improve the use of evidence and to make that change. So it's something that has a lot of support, that people really believe in, and we have large numbers of initiatives that we're undergoing to make that happen, which we don't have time to go into in great detail. Certainly qualitative data and quantitative are useful side by side. There's a genuine measure, which is sort of social optimization. You don't just measure numbers around costs and expenditures. You measure quality of life quite often as a metric. And I think a lot of the way that you need to drive this sort of thing forward is to make sure that whenever there's a policy decision being made and whenever money is put into something, that the things that you're measuring, the metrics are agreed up front, you track them as you go along, and you chart how well or how badly essentially you're doing against the metrics that you've agreed. So that decision around what are the most important metrics to track success of any policy that you're implementing is hugely important. And one of the big things that we're trying to drive at the moment is more consideration between departments, so less siloed approach really to managing important sort of governmental decisions, maybe around zero energy expenditure or social and housing, these sorts of things. You can do a lot more if you start to pull data streams together about the downstream impacts of various policies on other departments. There's a lot we can do, and yes, it's not quantitative.
And do people in government, many of whom maybe were recruited in a age pre the biggest of big data? Is it? Sorry, I thought I had till 3.
Oh,
you want me to end it then? I'm lost, sorry. Oh, right. Oh, I'm sorry, everybody. I thought we had till 3 for this session. It turns out we've only got till 5 to 3. So I've mistimed things. There were loads of questions we're going to come on to about data viz, things like that, but we haven't got time for that now. But I'm sure those are going to be picked up in the other sessions. And meanwhile, can you all virtually thank my fantastic panel there, Mevan, Laura, and Aidan, for giving their perspectives. Thank you very much.
Thank you.
Thank you.